This congressional conversation is sponsored by AARP Nevada. Visit our website at aarp.org/NV. Your voice, your vote, our fight.
Thank you for joining us for the Review Journal AARP 2020 Candidate Interview Series. I'm your host, Steve Sebelius. We'd like to thank our sponsor, the AARP, and all of the candidates for Congress who've agreed to participate in the debate. In today's conversation, we're going to be speaking with Congressman Steven Horsford. He's the Democratic incumbent in the 4th Congressional District, also a former Nevada state senator, former Senate Majority Leader in the state of Nevada, and former director of the Culinary Training Academy. Congressman, thanks for joining us today. We really appreciate your time.
Thank you, Steve. Good afternoon. It's great to be on, and thank you to the Review Journal and the AARP for putting this on.
So let's get started right off the top with probably the number one issue we've been facing in this very odd year, which is the coronavirus. Here in the state of Nevada, as you well know, unemployment soared to depression-era levels during the pandemic and the subsequent economic shutdown. A lot of older Americans have been disproportionately affected. What ideas do you have to help Americans older than 50 recover from the economic chaos that the coronavirus has caused?
Well, thank you. First and foremost, as you said, this pandemic has hit our community and our state in particular, unlike anything we've seen before, and our country as a whole. More than 205,000 people, unfortunately, have lost their lives, and millions across the world have been infected by the virus. And so my primary focus has been to work with my colleagues in the House in a bipartisan manner to deliver the relief and the assistance that people need. I am proud specifically as it pertains to older Americans that we have sponsored the Nursing Facility Quality Reporting Act, which is a bill that I sponsored, and it was included in the HEROES Act and passed out of the House. It requires the Centers for Medicare and Medicaid Services to publish demographic information on COVID-19 infections and deaths in long-term care facilities. This is something that we heard directly from our constituents when we were conducting telephone town halls and other outreach events, that people were very concerned about their loved ones and in some cases for themselves being in a long-term care facility and whether or not they were getting the testing, the treatment, and the contact tracing that was absolutely necessary. We also helped provide $25 billion of funding in the first CARES Act, which again did get enacted into law. And that provides funding to all of our healthcare agencies across the country, including here in Southern Nevada, to make sure that people have access to free testing for COVID-19. This is something that a number of our seniors have taken advantage of through various sites that the Southern Nevada Health District put up, including at senior centers in my district and at Walmart and other locations throughout the valley.
And you know, you, as I mentioned in the intro, you are the former director of the Culinary Training Academy, which is one of Las Vegas's premier, if not the premier, job training program for members of the culinary union. So you have some experience with this. Is there a greater need, you think, for job training for people who are older? It seems like older folks, when they either get laid off or for some reason have to look for a job after age 50, employers look at them and they say, well, this person's going to want a higher wage because they have all that experience, and they're going to want a health care, and those benefits may be more expensive than a younger person. Is there a job training component that should be targeted at specifically at those older Americans to help them find work after age 50?
Yes, and through legislation that, again, we have supported and that has passed the House, there was an investment of $25 billion for workforce development training to our local agencies, including the Workforce Connections, but specifically for individuals over 50, the first issue is we have to address age discrimination. People should not be discriminated in the workplace based on their age, first and foremost, as a protected class. But we know that unfortunately far too many people are not given those same opportunities or may lack some of the skills and training for the jobs that are available. So I know that a number of agencies, including Workforce Connections, have received funding from the CARES Act to help people get training and placement in jobs. I know this has been a very difficult time for so many people in our state because we had the highest rate of unemployment at one point during the summer months of over 30%. And while that number has gotten better, it hasn't gotten better for everybody. And that includes older Nevadans who are still struggling to get on their feet. And to be clear, they need a job to provide for themselves and put a roof over their head and keep food on the table and pay for medications like other families. And we need to make sure that they have access to training and to job opportunities.
Absolutely. All right. Well, we're going to take our first break. We will be right back with Congressman Steven Horsford, represents the 4th Congressional District, as our RJ AARP 2020 Congressional Interview Series continues. Stay with us.
Today is full of opportunity to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state. Because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.
Welcome back to the RJ AARP 2020 Congressional Interview Series. We're speaking with Congressman Steven Horsford. He is the Democratic incumbent in the 4th Congressional District. Congressman, a lot of people are interested in this. What can you tell us about the status of the coronavirus vaccine? There is a lot of speculation about when that is going to come out, and also some concerns about whether or not that's being rushed to the market for political reasons to coincide with the political calendar, and whether or not that vaccine is going to be safe, and whether people are going to feel safe in getting it.
Well, Congress, working with the administration, has enacted legislation and funding for Project Warp Speed to help pharmaceutical companies develop and produce vaccines. The issue is there's currently 4 major companies under trial in the 3rd stage of trial review. And it's my understanding that we should have a vaccine available that has passed all of the necessary trials by either the end of this year or the early part of 2021. The issue will be based on briefings that I've received as a member of the Ways and Means Committee and a member of the Health Subcommittee, is that the production of that vaccine may be limited to just 100 million people, particularly if people have to take more than 1 dose of the vaccine. One of the trials requires 2 injections, for example. And so that may limit it to about 100 million people, which specifically would go to frontline workers who are exposed to individuals who may have the virus, and to vulnerable populations, those with pre-existing conditions or underlying health issues that may require them to be prioritized. So we've got a lot more to do to get this vaccine fully available. My position is that we need to make the vaccine fully accessible and affordable to everyone. This is not something that needs to be limited to those who are well-connected or wealthy. It needs to be available to everyone. And I do want us to make sure that the vaccine has been reviewed according to FDA and CDC guidelines, that we're not rushing the process. Of course, we want a vaccine as soon as we can, but it needs to be to undergo all the necessary testing and reviews to make sure that there are no unintended consequences or long-term health effects that those trials will discover.
Absolutely. Well, still staying on the subject of healthcare, we know that Republicans have been opposed to the Affordable Care Act since the very beginning. It passed without a single Republican vote. There have been numerous attempts to repeal it legislatively. There's a lawsuit currently pending before the United States Supreme Court that would seek to repeal the law in its entirety. The Democrats have been fairly steadfast in supporting the Affordable Care Act. Let me ask you your position on that. Should we retain that Affordable Care Act? Should we scrap it and start over? How should we proceed when it comes to national health care?
Well, I fully support the Affordable Care Act. More than 20 million Americans now have access to health care because of the Affordable Care Act. In Nevada, we have been able to cut the rate of uninsured in half, particularly among children who were at a higher rate of being uninsured prior to the passage of the Affordable Care Act. And as you indicated, Republicans in Congress and under the Trump administration have attempted to repeal the Affordable Care Act more than 100 times since its enactment. And instead of working to make it better, it's not a perfect bill, but instead of working to make it better, they've worked to undermine, defund, and obstruct the successful implementation of the Affordable Care Act. This is very difficult, especially because right now, the Trump administration is in court. They have a federal lawsuit, Texas versus the United States, where they are literally petitioning the United States Supreme Court to strike down key provisions of the Affordable Care Act. And this is one of the issues that is actually on the ballot for voters to decide. I know that there are those who oppose the Affordable Care Act. They think it goes too far, that it costs too much, that they don't want to provide the benefits or protections under pre-existing conditions. That's their position. But my position is we need to build from the Affordable Care Act. I support adding to the Affordable Care Act a public option. This would not be something that is mandated for people to enroll in, but it would be an option for them, similar to Medicare, where those individuals at 55 years of age or thereabouts are able to enroll in Medicare as an option for coverage so that they have the same benefits and protections. This does a number of things. It actually provides more health care to more people. It helps spread the risk pool in Medicare to more healthy individuals, thereby reducing the cost of Medicare and helping the solvency of the Medicare Trust Fund for longer periods of time. And it's the right thing to do as far as I'm concerned. So that is one of the options that I support. But right now, we are trying to do everything that we can to prevent the president, Donald Trump, and congressional Republicans from their attempts to successfully cut these benefits or take the Affordable Care Act away from millions of Americans who depend on it.
All right, well, we're going to take another quick break, but we will be right back with more questions on the Affordable Care Act, following up on a couple of things that you said, and there's plenty of stuff ahead, Social Security, Medicare, etc. So stay with us as our RJAARP 2020 Congressional Interview Series continues.
Today is full of opportunity to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state. Because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.
Welcome back to the RJAARP 2020 Congressional Candidate Interview Series. We're speaking with Congressman Steven Horsford, represents the 4th District. of the great state of Nevada. So, Congressman, you mentioned just before we went to break about adding to the Affordable Care Act a public option. This came up in a presidential debate recently, in which it was intimated that the addition of a public option would spell the end of private insurance in America. Do you have any concerns about that? Or is that rhetoric that's designed to thwart any expansion of the Affordable Care Act?
Yeah, I share Vice President Joe Biden's position on this. This is not about ending employer-sponsored health insurance or those who choose to buy their health insurance through the Affordable Care Act marketplace, which about 2/3 total receive their insurance either through employer-sponsored insurance and through the Affordable Care Act private marketplace. So no, this would add to it, not eliminate that employer-sponsored insurance. And that's something I've been very clear on from the very beginning. I'm not an ideologue. I don't have extreme positions either from the right or the left. I'm about building pragmatic solutions that actually work for people. And I know based on the needs of my constituents, a majority of them want us to make healthcare more affordable, more accessible. They want to improve the quality. They want to make sure that the doctor that they see is available to them, and that we are improving the access and the quality to healthcare. One of the ways that we have to do that is by lowering the cost of prescription drugs, which I know is a whole nother topic. But this is one of the areas that we've got to do in order to make healthcare more affordable and accessible to more people.
Yeah, I have a hunch we'll get to that prescription drug costs issue in a second. Let me switch though before we do that. Actually, one last question on that. You mentioned about not being an ideologue. I know in 2016 Bernie Sanders said, "Look, we've got the ultimate public option here. It's called Medicaid. Let's just lower the age to cover everybody and have Medicaid for all." That was sort of an outlier in 2016. In 2020, a number of presidential candidates adopted that same view. A lot of people came around to that idea, but not all Democrats. Vice President Biden, as you have said, does not support that idea, and it sounds like you don't either.
Right, and Medicare for all is the idea, and the idea to provide more access to health insurance and to make healthcare a right and not a privilege is the underlying idea that I support. But I do not believe that Medicare for all is the only solution to get us to that idea. I support protecting the healthcare that people have now and expanding upon that through the Affordable Care Act by adding a public option. As a member, again, of the Health Subcommittee for Ways and Means, I have direct jurisdiction over this. Our committee oversees Medicare, Medicaid, the Affordable Care Act, and Social Security, among other issues. And so we are intimately involved in this debate. We've had hearings on these issues. And again, at a time when congressional Republicans and the Trump administration are working to take healthcare away from people, deny them protections through pre-existing conditions, and are in the Supreme Court trying to strike down the entire Affordable Care Act, if not key provisions, the last thing we need to do is disrupt that by putting everyone into a government-run healthcare program.
Yeah. Excellent way to slip in the fact that you were on the Ways and Means Committee, which is a very prestigious committee, and voters now know that. So we're going to take our next break, but we will be right back talking about Social Security, as a matter of fact, as our RJAARP 2020 candidate interview series continues with Congressman Steven Horsford. Stay with us.
Today is full of opportunity. to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state. Because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.
Welcome back to the RJAARP 2020 Candidate Interview Series. We're speaking with Congressman Steven Horsford of the 4th Congressional District and the Ways and Means Committee, as we found out earlier. Congressman, there have been proposals with regard to Social Security that talk about either fully or partially privatizing the system, perhaps not for people who are in it now or who are close to retirement, but rather for younger workers who are coming up through the system now. This would see Social Security taxes invested in the stock market and returns paid out from the gains of those stocks. Do you support something like that, either partially or fully privatized for younger
No.
workers, older workers, anybody?
I do not support privatizing Social Security
Mm-hmm.
or Medicare for that option. Look, these are trust funds that were established with one thing in mind. These are not entitlement programs. They are trust funds based on the fact that people have paid into them over the lifetime of their work life in order to prepare for and have access to the benefits when they need them for retirement under Social Security and for healthcare as it pertains to Medicare. So I know that there have been efforts, my opponent and others support efforts to privatize Social Security, but I do not. I will work to protect and preserve Social Security. And one way that we have to do that is by protecting the revenues that are paid into it. There was a suggestion made by the President, Donald Trump, that we should divert payroll taxes away from the Social Security Trust Fund, which actually would have made, according to the actuarials, the Social Security Trust Fund would have become insolvent as early as 2024, 2025, impacting current beneficiaries, not withstanding those in the future. So I oppose those efforts because they weaken Social Security. And let's talk about what Social Security is, please. I know your folks from AARP know this because they work really hard to protect it. But on average, a Social Security recipient in my district gets about $1,000 a month. Overwhelmingly now, people rely on Social Security as their sole means of income during their retirement because there are no longer employer-sponsored pensions, savings from 401ks, or other things to help them. And so they rely solely on Social Security. And out of that $1,000, they have to pay for rent, food, utilities, medical, as well as prescription drugs. And most of my constituents cannot get by off of the minimal amount that they get from Social Security. So by privatizing it or weakening it or taking away benefits, that will only make the conditions worse for the majority of the people that I represent.
You know, it seems like when you talk about Social Security, everybody loves it. An AARP poll found that 93% of Republicans, 99% of Democrats, and 92% of independents see it as an important government program. But surprisingly, this poll also found that 57% of people don't believe that the future of the program is secure. They either don't trust the government to keep its promises, they think the money is running out, they say politicians have taken the money from Social Security and used it for other things, or as you mentioned, the president's proposal to divert those taxes. What do you tell seniors on the campaign trail when they come to you and they say, Congressman, I'm worried that this program won't be there for me when I retire, or I'm retired now and I'm worried it's going to run out?
I share their frustration, and I assure them based on my voting record and support from groups like AARP and the Committee to Preserve and Protect Medicare and Social Security, which I'm proud to have their support, that I assure them that I'm going to continue to defend their benefits. And that means standing up against powerful interests and special interests, that some of them are the ones advocating for these policies. Think tanks out of Washington who don't know what it's like to live on $1,000 from Social Security, or have to have a loved one who relies on Social Security for disability benefits. Steve, I think I've shared this story with you, but 9 weeks after I was born, my grandmother had a severe stroke and was paralyzed after coming out of a coma. And she required 24-hour medical attention and ended up needing to be in a nursing home for 27 years of her life until she passed away in April of 2000. So from the point that I was a little boy until my 20s, I visited my grandmother and by her bedside in a nursing home. I didn't know at the time when I was young, but it was Social Security and Medicaid that allowed my grandmother to have that quality of care for the numbers of years that she did. And so when I hear from constituents who tell me that they're concerned, I understand it. When they are worried about their loved ones being able to receive the care and the benefits they need under Medicare and Social Security, I get it. And that's why I will continue to fight and defend these benefits, because they are not entitlements. We do not need to balance the budget on the backs of our seniors or those who paid into Social Security in order to fix our fiscal problems. We can do that without doing it on the backs of older Americans.
All right, that's a perfect segue, because when we come back from this next break, we'll talk about ways to extend the future of the Social Security program and run some ideas by you for a yes or no. But stay with us as our RJAARP 2020 candidate interview series continues.
Today is full of opportunity to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state, because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.
Welcome back to the RJAARP 2020 candidate interview series. We're speaking with Congressman Steven Horsford. We're talking about Social Security. There have been a number of ideas that talk about how to extend the program, because the actuaries have said that the trust fund will be exhausted by 2035. Although with the coronavirus pandemic and so many people being out of work, not paying in, they say even those estimates might be too optimistic. So they propose a number of different ideas, some of which are embraced by Republicans, some by Democrats, some by neither. What do you think of raising the Social Security withholding threshold, which would essentially tax higher wage earners a little bit more to pay for Social Security wages?
I support that approach. I'm a co-sponsor of Social Security 2100. As you said, right now the solvency may expire by about 2035. Our bill would extend the solvency through 2100 by taxing people. I believe it's over 132,000 up to 400,000. So right now, if a person makes, they're only taxed for Social Security up to that $132,000 threshold. Anything over that amount, they're not taxed anything. So the rich CEOs that make millions upon millions, they only pay up to 132,000. They don't pay a dime over that amount. Our bill would require them to pay between 100 and income up to 400,000. Let me put it that way. And so it still doesn't place that burden on everybody, but it does do a better job of getting more money into the Social Security fund to extend the solvency through 2100. And I support that approach, and I'm a co-sponsor of the bill. We've had hearings in our committee, and I've actually brought my colleague, Congressman John Larson, who's the chair of the subcommittee on Social Security, on Ways and Means to my district to meet with constituents about this very issue, and they fully support it.
What about increasing the current withholding tax that's applied to wages now? Do you think that should go up or no?
So I support first starting with the making people over that threshold pay something more, because that gets the wealthiest people to have to pay more into the Social Security Trust Fund. I don't know that we need to tax everyone more because there are middle income and lower income individuals, particularly right now during this pandemic, that are struggling. And so that would not be one of the solutions that I would look to implement first, but it's definitely something that could be considered in the long term.
Yeah, there's another idea that would raise the retirement age in order to receive full benefits. Now, there are some people who say that this would disproportionately impact people of color because of life expectancy, and they've opposed it for that reason. What do you think of that idea?
I oppose raising the eligibility age. You pay into Social Security so that when you retire at your age of eligibility, which is currently 65, that you can receive this benefit unless you have a disability, in which time you can receive it earlier. I do not support making people have to work the rest of their lives and then die and not receive the benefit. So I want people to be able to enjoy their retirement and enjoy the benefits of the Social Security that they've paid into over their lifetime.
All right. This next one I've asked all the candidates, and that is about a means test. If I, for example, went down the street to the Green Valley Ranch tonight and I was lucky enough to win the megabucks, and my income suddenly ballooned to the point where I could retire tomorrow and never work another day, I wouldn't need my Social Security when I got to age 65, or in my case, it would be 67 when I retire. I wouldn't need that. Should there be a means test for that? You said it's not an entitlement. You've earned it. You've paid in. You deserve to get it. But if you don't need it, and there are other people, as you said in your district, $1,000 a month, who do need it and could get a boost, and should there be a means test and a reallocation of money under that circumstance?
I don't believe so. For the very reason that you said, it is something that people have paid into. It's not an entitlement. It's not based on income. It's based on what you paid into over the course of your working career. And this again goes to the fact, as you said, some people, unfortunately, women in particular, are not paid the same amount as men doing the same job. So they already are disproportionately impacted by what they get in Social Security at the end. So we've got a lot of other issues to address around the inequities. I would focus on those first and foremost. But even if someone who's paid into it and may not need it themselves, they may choose to use that amount that they receive in their retirement for loved ones, for children, for other family members, and it's their choice to be able to do that.
Yeah, on a voluntary basis, not a compulsory basis. All right, sounds good. All right, well, we're going to take another break, and when we come back, we're going to talk about the Medicare program, another big program of interest to members of the AARP. So stay with us as our RJ AARP 2020 candidate interview series continues right after this.
Today is full of opportunity to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state, because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.
Welcome back to the RJ AARP 2020 candidate interview series, where we're talking with Congressman Steven Horsford of the 4th Congressional District. Congressman, we talked about the Medicare program and expanding it to everyone. So we know your position on that issue. But we also know an AARP poll found that 93% of older voters want their candidates to discuss what they're going to do to prevent any cuts in the program. Now, I'm assuming you're against cutting Medicare benefits. What are you doing? What have you done to prevent that program from experiencing cuts?
So this issue directly aligns with lowering prescription costs. So I am a sponsor, a primary sponsor of the Elijah Cummings Lowering Drug Costs Now Act. It's HR 3. It's a bill that, again, we worked on in our committee, Ways and Means, and it was voted out of the full House. This bill requires Medicare to be able to directly negotiate with drug companies for lower costs, saving the Medicare trust fund a considerable amount of money. And the savings in Medicare extends the life of Medicare, but we also are able to take a portion of those savings and actually expand benefits to include providing vision, dental, and hearing for Medicare beneficiaries who need those services on a limited basis. So that is something that we've already voted on in the House. This is a bipartisan issue. We are trying to get support from our colleagues in the Senate and the administration to ultimately take this bill up, we hope, before the end of this Congress.
That's that is a considerable amount of money if you're talking about extending benefits to that extent. Do you worry at all, as some critics have said, that negotiating for those drug prices will remove an incentive from pharmaceutical companies to do the kind of research and development that develops brand new drugs that are better than the drugs we have now to treat all sorts of different ailments? Is there a consequence?
Well, look, my job is to represent the people, not the pharmaceutical companies. Those are the arguments that they've made, but here's our response. First and foremost, Medicare is the biggest buyer of prescription drugs in the marketplace. And so for them not to be able to negotiate, I'm not saying set the rate, I'm saying negotiate for a lower rate. We're not saying what the rate has to be mandated by Congress. We're saying it must be negotiated. That negotiation must be transparent. The other thing is the VA does this already. The VA negotiates directly with drug companies under the TRICARE program for lower drug costs. The Department of Defense negotiates with defense contractors when they buy F-35 planes. They don't just buy them, they negotiate the price. So why wouldn't Medicare be able to negotiate when they are the largest market? They are the biggest buyer of prescription drugs. They're bigger than private insurance. They're bigger than state-run plans. They're bigger than the Affordable Care Act. And so we want to empower the Secretary of Health and Human Services to be able to select, and it's not all drugs on the Medicare. So there's a Medicare list of drugs. There's over, I believe, 8,000 drugs that are on the Medicare list. What the bill HR 3 does is it says the Secretary of Health and Human Services can select up to 50 of the highest priced drugs, and those are the drugs that they can negotiate with those companies for a lower cost. And then from the savings, we're able to extend the life of Medicare and expand benefits to include vision, dental, and hearing, which is something we desperately need. I literally have constituents who are under Medicare who can't see a dentist, who need hearing aids or other devices, and who need to be able to get eyeglasses. And those are items that are not covered under Medicare at this time.
And that is a surprising thing. When I first found that out, I had no idea. A member of my wife's family was in the program, didn't have dental care, and I said, well, but he's in Medicare. Why don't just go to the dentist? And then she told me, no, Medicare doesn't cover dental procedures. And so that was a revelation to me. But we're going to take a quick break, and we're going to continue on this subject of Medicare in just a second. So stay with us as our candidate interview series continues. We'll be back right after this.
Today is full of opportunity. to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state. Because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.
Welcome back to the RJ 2020 Candidate Interview Series, co-sponsored by the AARP. We're talking with Congressman Steven Horsford, and we're talking about Medicare. It sounds like if this bill that we were talking about before the break passes, the Elijah Cummings Lowering Drug Costs Act now passes, there wouldn't be a need for any kind of tax increase to support the Medicare program. That the savings from those negotiated prices would extend the program and even add to benefits.
Correct. And what we have to do is defend efforts to take the savings. There are some proponents on the other side of the aisle that want to take the savings and use them for other things outside of Medicare. And that's what we would fight against. This is where you have to have strong people in office who know what they're doing, who have experience, and who can follow the process to know that is not in the best interest of the Medicare program in the long term. Yes, we have other fiscal needs and other demands, but we should not be robbing from the Medicare trust fund to address other fiscal needs in the federal government.
Yeah, and you said that not only would that cover dental procedures, it does. Medicare also doesn't cover things such as eye exams for prescription glasses, which you would think older folks in the Medicare program would need. Routine foot care, which is important for diabetic patients. Fittings for hearing aids. These are all things that older people need that are not covered by Medicare. But under this bill, if this bill were to be passed and signed by the president, those things would all be covered.
Correct. And they're things that make a lot of sense. And this is not partisan. This is about people. It's about doing what's right to help people improve their quality of life, particularly older Americans. Again, just think of someone in your family, and if they can't see a doctor and they have dental issues, that is going to potentially affect other health-related issues like heart disease, diabetes, as you said, potentially cancer if it's not treated right. So this is about preventing other ailments, which actually might be covered under Medicare. So why wouldn't we provide the preventative care and at a lower cost from the savings rather than have someone go through the pain and the anguish of getting a worse disease or other health issue that requires Medicare to have to actually foot out even more money for that individual.
We've got about a minute left in this segment. One of your former colleagues in the Nevada State Senate, Ivana Cancela, recently passed a bipartisan bill that introduced drug pricing transparency for insulin to treat diabetes and also for asthma related drugs. Do you think something like that could work on the national level, a pricing transparency bill that would help bring down costs, not just for Medicare, but for everybody?
So what I failed to mention is actually I introduced Senator Cancela's bill in Congress. It's a federal, mirrors her bill in that it requires drug companies specifically for insulin, but my bill, it covers other life-saving medications. If their costs go up more than 25% over 3 years or more than 10% in any 1 year, or if the launch price is more than $25,000, then they have to disclose all of the costs related to that increase. And it's a transparency bill that's modeled after Senator Cancela's bill, which was passed in the Nevada legislature. I commend her for that groundbreaking legislation. It's being it's being implemented, and we're continuing to monitor that process. But that provision is actually included in this H.R. 3 Elijah Cummings bill. I focused on the larger issue of Medicare, but the issue of price transparency is also included. I'm proud to be a primary sponsor of that provision.
All right. Well, we're going to take our last break. We'll be back for our final segment with Congressman Steven Horsford right after this. Stay with us.
Today is full of opportunity. to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state. Because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.
Welcome back to the RJAARP 2020 candidate interview series. We're speaking with Congressman Steven Horsford. Congressman, you mentioned at the beginning the fact that your grandmother was in a nursing home for a long period of time, courtesy of Social Security and Medicaid. Those facilities have become the focus of a lot of attention in the COVID era because there were spreading events there. What can the federal government do? What should the federal government do to make sure that those facilities are safe, that people feel comfortable putting relatives there and visiting and all of that?
So this is such an incredible issue. Of the more than 200,000 people who've died, more than 100,000 of them are seniors. And most of those seniors are seniors who were in long-term skilled nursing facilities. So it's a real issue. It disproportionately affects those in those facilities. And so the federal government's role is that through the Centers for Medicare and Medicaid Services, we provide regulation and oversight because a lot of these facilities receive funding through Medicare, Medicaid, Social Security. And so that is the federal government's reason for having a stake. The state governments also provide oversight, particularly in the licensing and any state standards that are required. So it's a federal state role. I have a bill, the Nursing Accountability Act, that we have been working on, again, on our committee. We've conducted hearings on this issue. First and foremost, we have to have high standards in every healthcare environment, but particularly in nursing homes. Secondly, many of the frontline healthcare workers in these facilities, these are some of the lowest paid people in the healthcare profession. And so they need to get hazard pay and other benefits, particularly so that they're not in a position to where they don't have a choice to not show up for work because they have to provide for their families, and God forbid they're spreading COVID. I just conducted a roundtable discussion with a number of the facilities in my district, including in Mesquite and out in Pahrump, because we have rural and as well as urban areas, and the needs are different in different communities. And so it's also about listening to the administrators of each of these facilities. They need more access to PPE, more testing, more funding for their essential workers, and we need to help them get the reimbursement that they need to fund their facilities. So those are the priorities that we're working on, and we're going to keep doing it because these are the issues that matter most to the people in our district.
Great. Well, Congressman, thank you very much. It's all the time we have for our discussion. I really appreciate you taking the time to meet with us and talk about these issues.
Thank you, Steve. Great to see you. Be well. Take care.
And also thanks to our sponsor, AARP. You can stay up to date on all the 2020 political news on our website, www.reviewjournal.com, or on our mobile app. Until our next segment, which we hope you'll tune in for the Las Vegas Review Journal, I'm Steve Sebelius.